All right. Welcome. Thank you for joining our Health Equity Forum, April 2024. For everyone who's joining us online, a quick reminder to keep your microphone muted unless you have something, a comment or a question, in which case, please use your raise hand icon. And if you could announce your name and your organization before you speak, that would be appreciated. The meeting is being recorded and live streamed, and I will go ahead and turn it over to my colleague Raymond.
Good afternoon, everyone. Thank you for joining April the 22nd Faculty Forum. We'll go through the agenda. And we just have a really great agenda today. Some very diverse speakers sharing about some different aspects of minority health in our Anne Arundel County. And it's just my pleasure to also introduce Dr. Tope Bada. And I'm going to share her bio just briefly, and then I'm going to turn it over to share a little bit. Dr. Bada is a board certified OBGYN and Maryland native. Dr. Bada went to a medical school at Howard University in Washington, D.C. After her residency training in New York, Dr. Bada returned to Maryland. Since returning to Maryland, Dr. Bada has worked in private practice and held several leadership positions while in academic practice in D.C. Before coming to Anne Arundel County, Dr. Bada worked in Howard County Health Department as a clinical director of sexual and reproductive health. Once again, a warm welcome for our new Deputy Health Officer, Dr. Bada.
Hi, good afternoon, everyone. Thank you for allowing me to be here and participate during this forum. I was asked to say a few words about National Minority Health Awareness Month, which is an annual observance that happens every year in April. Its purpose and goal is to build awareness about health disparities that persist among racial and ethnic minorities. And as an OBGYN, it's not a coincidence that this also is during April, we have Black Maternal Health Week. And so I think it's really important as public health servants to really kind of highlight and have an opportunity to talk about and really bring and elevate the issue of health disparities that really kind of impact our neighborhoods and Anne Arundel County residents. So the theme of this year's National Minority Month is Be the Source for Better Health, improving health outcomes through our cultures, community, and connections. And I think the theme of this year really speaks to understanding health disparities and the social drivers of health. And for those who don't know, the social drivers of health are things that really impact where we're born, we live, we learn, work, pray, and play. And those things are always kind of in the forefront of our mind in the Anne Arundel Department of Health as we go out and create programs that really help to decrease the disparities that really exist, and also make sure that we are fulfilling our mission to preserve, promote, and protect the health and well-being of all people by advancing health equity in Anne Arundel County. And I think it's really important that as we plan our programs in partnership together, that we continue to always be innovative in our programs that we are developing, and just remember the community that we are centering in our work. I think this allows us to kind of keep focus on like what we're doing, also kind of reaffirms the importance of our jobs. I think that we are all fulfilling a mission, and I'm grateful for the partnerships that this forum allows us to create in order to be able to erase health inequities, hopefully in the future. Thank you.
Awesome. And once again, thank you, and welcome to the team.
Thank you.
Next, we're going to be having our health officer, Dr. Tony Gedden, and going to be sharing a little bit about the maternal health sessions that have been going on around the county.
Thank you, Raymond. So I think we might have told you all a few months back, in November of last year, we started a maternal and infant health task force for the county. And that task force includes a lot of professionals who make up various aspects of maternal and infant health. So looking at pediatricians, OBGYNs, mental health professionals, social services professionals. And we think that's an important thing to do because we see really wide disparities, health disparities when it comes to maternal morbidity and mortality. And we want to make sure, and infants as well, we want to make sure that as a county, we're coming up with strategic ways to address those and bringing together the folks who are working in those various spaces. But one thing that our task force does not include at this moment are community members. So how do we go about really hearing from those that have the lived experience as we're trying to put plans together for the county? And then how does that continue so that it's not, oh, we heard from you here and then we'll see you in another, 6 months or a year from now. So we wanted to start with a listening session. So we're hosting 4. We've done 2 of the 4 so far. The first one was virtual. We had one last week at the Severance Center, which is where you see the pictures there. And then we have 2 coming up. So on May 2nd, we will be in Annapolis. And in a minute, I'll remember the name of the exact church over the page.
The Eastport United Methodist Church.
Thank you. We'll be in Annapolis at the Eastport United Methodist Church. And on May 11th, we'll be in Brooklyn Park at the Arts Center. So we want to hear from folks. If you are particularly centering this conversation around Black mothers and Black birthing people, making sure that we are addressing, because we see the highest disparity in maternal mortality amongst Black residents. So from a national perspective, Black women are about 3 times as likely to die from pregnancy-related complications. And we want to make sure in Anne Arundel County, again, what are we doing and what are their experiences? What do they think we should be doing as it relates to this issue? Just not what the professionals think, right? Because we're all invested in various ways, but what do we learn and what do we gain from hearing from the community as to what would be useful before we're really creating new levels of plans? And so we also want to inform the community about what we're seeing. So the slides that you see in front of you, the way that we've structured these meetings, and you all have participated in one because we had a data walk here over the holiday. It's really having these same sort of graphic depictions of the data itself, so not your typical graphs necessarily, and having a conversation around what people are seeing. What do they understand, and level setting the reason for why we're having the conversation. What we've quickly found out, and you can actually move to the next slide, please. So we'll tell you a little bit about what we've heard is that people aren't necessarily surprised by the data, right? They don't know it to the T of like, oh, we know it's this number or this percentage, but they're aware and they come with additional questions about what the data means. What are the trends from that data? And then what we really want to understand is once we've level set that, what do you think we should be doing? Here's a couple of things that we've heard so far. Education for birthing people. So understanding when something is wrong, what it looks like throughout the pregnancy and postpartum. A lot of folks are saying there was an assumption that I would know something or that I should know what the symptoms, if I look like, if things aren't going appropriately and what to do. And people feeling like they need more education about what pregnancy looks like and the postpartum period. Also the use of technology. We heard particularly in the first session about people saying, don't recreate the wheel. There's some good stuff out there. We don't want you to recreate it, but you do need to make sure people have access to it. So thinking about apps that provide, this is what you should be seeing at week 12, right? This is what you should be experiencing around week 26. Also feeling that there was a lot of those apps that told you what to expect with the baby. It didn't necessarily tell you what to expect as the person giving birth, right? You weren't hearing that information. Say the baby's as big as a kumquat this week, and they may start to develop their hearing and that, but it didn't give you information on yourself and like, you should be feeling this. Understanding the drivers of the disparities. We get a lot of questions when we look at the data about, well, what about genetic contributions to this? What about people's ability to eat healthy? What about all of the other factors that may play into why these disparities exist? And then providing training. So making sure that providers have implicit bias and cultural sensitivity training. What do they receive? What should you expect? How do you know if your provider has had any level of training? Is there a way to find out? So this is just a little of what we've heard so far from the community. Again, we have 2 more sessions coming. So what our ask of this group is really to let folks know. We'll make sure, and I think probably we've sent it out already. I think I got it from Keith once or twice, but we'll continue to share those as the dates get closer. But asking you all to help us get the word out, to get people to these meetings. It's really important that we develop these relationships because we do want to create in the future a community advisory board. So if you know someone who's particularly interested, and we've got a couple of folks that have come out and would like to continue participation. Again, as we're developing the strategic plan, we want that community feedback all along the way. And as this task force continues, right, if we have ideas, we want community members to be able to bounce those ideas off of and say, what do you think? Or where do you think we should be headed to this? And not just developing it and then giving it to people as this is what the professionals think. Because I think as professionals, if we get it all right, we're looking good. But we don't, right? And a lot of the reason I think that we don't always get it right is that we're lacking a full understanding of what the community is looking for over the needs from us. I'll see if there's anything, Peggy, Donna, Tope have all participated in these. If there's anything else you all think we should have.
Have any of our health ambassadors been able to attend any of the sessions yet, for the maternal health sessions yet? Virtually or in person? Any feedback?
Maybe that as far as when I attend as a cultural, that we talked about it, that they, approach with a cultural sensitive, approach from the provider and from us too, because we're very different culture. Just a norm behavior or norm action may be very sensitive to us. So we discussed that also and maybe providing them different feedback for the provider, the other side of the table, the patient versus the provider. And I think they'll be very helpful by understanding this kind of way. And we understand as well as what's the Western culture is. And we also educate ourselves. Those kind of things was very helpful to talk about it on that upset.
Sure.
Well, we look forward to sharing with you more what we hear at the listening sessions and then what the task force is coming up with. At this time, we're still working our way through really a gap analysis to see what we think as a task force is missing in the county and where we do have a lot of assets and how we can share those things across our groups to make sure that we're all aware of the resources that do exist in the county. We know that that's often a barrier even amongst providers, is knowing what the resources are that are available to the clients that they're serving and the patients that they're seeing. So again, you can find out more. Registration is not required, but it is really helpful for us, particularly because we provide free giveaways and dinner during these sessions. And so if you want to register or learn more, the link is there at the bottom at aahealth.org/listen. But it is not required, so folks are free to come and join us. They're held typically from 5:30 to 7 in the evening. And we will also be looking for additional ways to get the word out, to get feedback after the listening sessions are completed, if we feel like we still need more information. Thank you.
Thank you so much, Dr. Getty. My next presenter is Jennifer Barber, who has been with the Anne Arundel County Department of Health for 12 years. She began as a case manager in HIV, STD prevention and care. 2 years ago, she became the program manager. She said she couldn't imagine working anywhere else. And she's now working part of the 4th Friday Annapolis Pride event. So Jennifer, you want to share a little bit?
Sure. Thank you, Raymond. I'd love to share. Good afternoon, everyone. As Raymond said, I'm Jennifer Barber. I'm the program manager for the HIV STI Prevention and Care Program here at the Anne Arundel County Department of Health. And thank you so much for having me. I'm very happy to share our past Pride experiences and invite anybody that's interested to walk in the parade with our team. This year, the Pride Parade and Festival will take place on June 1st here in Annapolis at Maryland Hall. This year, the event is going to look a little different from years past. The prior events took place on Interwest Street in downtown Annapolis, and this year it will be at Maryland Hall. My program has had a long-standing relationship with Annapolis Pride, and we've participated in the event since it began in 2019. This will be our 3rd year, and as always, we are just super excited for this amazing event. The festival continues to grow each year, as does staff participation. And again, we invite all that are interested to walk in the parade with our team. So please reach out and email me if you would like to join us. This event is really lots of fun. We're able to reach countless members of the LGBTQ plus community and promote our program along with the health department. HIV, STI prevention and care. We will have a booth and we're usually located next to chronic disease prevention. We give away lots of fun promotional products, resources, and educational material. And our booth stays busy from the time the festival starts until it ends. The event is family friendly. There's food, entertainment, activities, resources. And as I mentioned earlier, it gets just bigger and bigger and more fun every year. Pride is the highlight event of my program, and we are so thankful to be able to participate in such an inclusive event. We manage to have fun while providing information, resources, and promoting our services. So thank you so much for having me, Raymond, and I would be happy to answer any questions if there are any.
We're gonna run the video that I believe you guys put together for last year.
Okay.
So we're gonna just run that. Ray get real good right there for a minute. There's a lot of information inside of the chat. There are links there. Jennifer, is there any cost for or anything of that nature that we should be able to look to or look for?
I'm sorry, Raymond, I didn't hear the first part of your question.
I'm sorry, is there a cost for any booth space or table space? Is there a cost to that?
Yes, there is a participation fee. You can go on to Annapolis Pride's website and they will give you the fees. I believe it's in the neighborhood of $150 for a booth. And you could participate in the parade only, the festival only, or both. And we always participate in the parade and the festival. And like I said, it's a wonderful event. It's so much fun. We are able to reach just so many residents of the community. And, please put on your rainbow gear, show your pride, and join us in the parade. Would love to have you.
Okay. And do you want to speak to the free sex kits? Do you want to speak to that really quickly?
Yes, we give out our safe sex kits, testing information. Our safe sex kits have become very, very popular recently. We always send out around 100 per month. Now we're up to about 300. You could order them free through aahealth.org, and they contain condoms, female condoms, and HIV, STI, facts, and PrEP resources. They're also in the vending machines at Langley Road, free of charge, and at the Annapolis Library that's located in the mall.
Any questions, any comments? In the chat?
Is it possible for us, like say, because we are having a wellness event, would it be possible for us to like procure some kits for residences?
I'm pretty sure. I'll make sure that you make that connection with Jennifer and her team. And
Okay.
we can let her know the amount that you would need for that day.
Yeah, we would be happy to help. Well, if you could email me, or Raymond could provide my contact information and we could coordinate.
Okay, thank you.
You're very welcome.
Thank you so much, Jennifer. We look forward to participating or seeing pictures again from next year. Maybe see you in that dance line that it was ready to go in that.
You won't see, nobody wants to see me in that dance line, trust me. But please join us. It's lots of fun. And thank you so much for having me, Raymond.
Thank you for sharing. Okay, we have next on we have Donna Perkins, of our Office of Assessment and Planning, our Director of Office of Planning, we're sharing some legislative updates.
All right, so the Maryland General Assembly has just wrapped up for another season. It runs from January through April. This year it ran through April 10th, so it's 90 days. And legislation moves fast and furious. So here at the Health Department, we try to track a variety of legislation, and I wanted to bring today some interesting updates that happened during this session, and we can go to the next slide. So these are just a snippet, just a quick overview of some pieces of legislation that passed this year that might be of interest. So the first one is, and you'll have to forgive me, I'm going to do legislation speak just so you all can track which one I'm talking about, but HB 0728. As you can see, they like to make really long titles sometimes with legislation, which I find confusing. So we're just going to go with this. Oh, no, not yet. Not yet. Oh, no, too far. Okay. Oh dear. I think our Zoom got possessed there for a second. Apologies. Thank you, Alex. All right. So first one is what's called the Qualified Resident Enrollment Program, or Access to Care Act. So for this, the key thing here to know is that Maryland has to submit what's called an innovation waiver by July 1st of 2025. And what that means, they're going to be asking to be able to utilize our health benefit exchange to allow residents of the county to be qualified to get in on that Medicaid exchange. So the only qualification is that you've got to live in Maryland. It doesn't require proof of residency. It literally is for everyone who lives here. So the next step for this one, so basically what the General Assembly said is, yes, we want to go for this. So stay tuned, because obviously this is going to take a little while, but this would be a really great thing to have in place for our residents to be able to access health insurance. The next one, HB 1333, is geared around requiring a statewide health equity plan. So we have a health equity commission for public health. However, they don't yet have a plan. And so this is requiring that commission to create a health equity plan. And then they also have to examine the health of residents and ways for both the state and local governments to collaborate and implement policies that would positively impact health. So for this one, again, it's going to take a little bit of time. So you've got a minute, but this report is going to be due on October 1st of 2025. Third on the list on this slide, SB 0991 is a pilot program that I thought was really interesting, where it's going to establish a language assistance services program for the Behavioral Health Administration. And this one is geared around children. So for children and also their parents and guardians who are making health decisions for those children, this is just a small pilot program to test it out to see if providing grants to reimburse the behavioral providers for language assistance services is going to be a benefit and use. So it's going to start small, but it looks like this would be something that they're at least interested in seeing how it rolls out and seeing what could be useful for the future. All right. Next slide. I tried to keep it brief. All right, so SB 0119 is the about gender affirming treatment. So basically this adds the language for gender affirming treatment into what's considered legally protected healthcare. And so that means that the direct provision or support or provision of care all falls onto this umbrella of legally protected healthcare for those who seek gender affirming treatment. And the last one I'm going to feature today before the star of the day does his presentation on legislation is HB 0522. This one requires the Maryland Department of Health and the State Department of Education to work together and establish guidelines to accommodate students in middle and high school who need telehealth appointments during the school day. So this means that middle schoolers and high schoolers would be able to actually seek medical services and get a telehealth appointment during their actual school day. So this is working together to create what that policy and guideline would look like. All right, sure, that was a lot. Any questions? Yeah, well, thank you all so much. And if you do think of any, feel free to let me know and I will try my best to answer them. Because like I said, legislation is drinking through about 5 fire hoses at once for about 3 months. Thank you for letting me share about these.
Thank you
Yes,
so much.
ma'am.
I have a question. When you're talking about telehealth, what type of health are we talking about?
They did not, if I remember correctly, the bill just said telehealth. It didn't specify if that meant mental health or physical health. It didn't differentiate between those, from the best of my recollection.
But it could be either or.
That was my assumption. It just said telehealth. So we'll have to see what rolls out in the policy that's being created. I think that will also help dictate what the expectations are for that. So I think this is one where we need to see what the Maryland Department of Health and State Department of Education come up with for what they consider appropriate for telehealth.
Thank you.
Thank you, Donna. So we're going to our next slide, and then definitely excited to introduce Cameron. I'm going to read his bio. We're going to do a video, and then I'm going to turn it over to him. We'll go to the next slide. Cameron Marcus Cardin. I'm Anne Arundel County resident. I'm Anne Arundel County resident and advocate. I'm graduated from Annapolis Area Christian School. He's attended St. Thomas More, Western New England University, Salisbury University, and the University of Maryland Global Campus. Been in administration. He is currently employed with the Anne Arundel County Department of Health, and he loves playing football and video games. And we're going to run a video just to share a little bit about Cameron's story. Then we'll let him go into depth about it.
Cameron Cardin to leave Salisbury University.
Now the former student is helping bring change to how schools handle students who withdraw from college because of a mental illness. WMER2 News' Jeff Morgan shows us how Cardin is leading the charge for change.
Cameron Cardin's college career started like many others, excited about the prospects and freedom universities bring.
I'm a very social person, so I fit in with the football team and the athletic department and everything.
Within a few weeks, things changed when racial slurs were slapped on the walls of one of the buildings where he attended class. A racial slur-filled phrase threatened harm against black students at the university.
It was so terrifying because, you know, I'm 3 hours away from my house and it was just I'm by myself.
During a weekend visit from his parents, his mother, Gay, noticed a change in her son.
It was terrifying for me to see my son in a situation like that.
Cameron decided to leave the university before the end of the semester. The incident made staying at school unbearable, even prompting him to seek professional help. Then the family learned they wouldn't be getting any refund for the semester of school he wasn't able to complete.
Where you pay for education, you pay for security, you pray for wholeness. And when that is taken away, that is devastating.
At a community event, Cameron's mom met with Delegate Shanika Henson, which sparked the Cameron Cardin Act. The bill would make it so students facing extenuating circumstances would be able to withdraw from the school and be reimbursed.
And when she shared how that affected his life, the anxiety, the depression that followed, and then the unfortunate incident of not being able to be reimbursed for their tuition so she could put that money towards the expenses of his treatment and care, I was so disheartened. I realized that there was something we had to do.
This is the third time Henson has introduced the bill. The first time a Senate sponsor has put it through, giving it a much better chance to pass.
In college, we all know that depression is real. It could be depression because someone is being bullied, or it could be because of one's grades or bills or any number of reasons. And I think we ought to take that seriously.
The bill got unanimous approval in the House last year, but never got a vote in the Senate. We reached out to Salisbury University for the story. It declined to comment. In Annapolis, Jeff Morgan, W.
All right, so Cameron, you can tell us how the story
You won't believe how old she is.
Excuse me?
So, yes, I'm Cameron Cardin, and I just want to say thank you for the opportunity to speak before you today. Just want to thank the Health Equity Committee for having me here. And I just want to talk about how education is so important to the Cardin family because my mom and dad graduated from University of Maryland. My dad graduated from Virginia State. So it was always preached around the house that education is very important. So that's why I wanted to further my education and come home actually to further my education. So I was just excited to come home and be close to home and finish my education. But I was very shocked when I went to school. It was about my first class. I was 2 weeks in and I saw racial slurs on the wall. And I brought it up to my professor and he was just like, oh, okay, don't worry about it. We'll just paint over it and it'll be gone the next day. So next day I had class and they painted over it. And once again, I went back to the same wall. It was more racial slurs there. So I actually called my mom and it was parent-student weekend and my family came up and I was showing them around and we had a good time, but I was just telling my mom that I was just fearing for my life that time. And we actually went to the president and the dean of students and the council. And I just told them the story and what happened. And they just didn't really hear my side of the story. So it was just kind of heartbreaking to hear that. And they said, we would not reimburse your money if you left. But if you got hurt playing football or something, we will reimburse your money. So that was kind of sad. Next slide. This slide just reminded me on how I felt, how my demeanor changed when I heard that I wouldn't get reimbursed my money. My social skills turned into loneliness, my happiness turned into sadness, my self-confidence actually turned into fear. And it just didn't feel safe about losing my tuition, and because of mental injury, then this is not the place for me. So like I just had to disenroll. Next slide. So my mother was attending an event in Annapolis and met Delegate Shanika Henson and shared my story. The past 2 years, the Cameron Cardin Act passed the House unanimously and could not reach the Senate, as you saw in the video. This year, the bill was cross-filed with Senator Anthony Muse, and the Cameron Cardin Act of 2024 passed both houses and waiting to get the official signature from Governor Wes Moore. So in July of this year, the bill would allow students in Maryland universities and state schools to disenroll if they are faced with any mental illness with proper documentation and be refunded with their monies that they paid. So, yes.
Any comments, any questions in the room? Ms. Gay, anything you want to share?
I just want to say, I want to thank Cameron for his perseverance to complete this, because every time we talk about it, it's uncovering the wound. But I would like to thank Anne Arundel County Health Department, because he's with customers every day, and to see the plate coming here because customers are first. And this has been therapy for him. But this has been a mark for other students to come. We wouldn't want them to go through what Cameron went through. So he has been a trailblazer as far as making sure that education is so important, but yet you'll be able to disenroll if there's a mental injury. So I just want to applaud him for his bravery and his courage.
I also want to say thank you, Cameron, for courage and letting your pain have purpose and opening a doorway and a pathway for our young people. One, see that out of pain, you can do something good with that. So thank you.
I think this is a department, we're extremely proud of the work that you've done here, because we do talk a lot about mental health. and having it be recognized equally to physical health, right? If you've been physically ill, get your money back for your tuition. And so not making that differentiation for mental health reasons, just understanding that it is as equally important. And it is not easy to talk about your own struggle. So we applaud you for just being able to, and this is a very public television, to have the act named after you, right? Like all of these things. Make it very public, and oftentimes mental health people, the stigma behind it, people don't want to talk about it. And so just your ability to even do this publicly this way is really admirable.
And just so you know, the chat is buzzing, pretty much, everything is your courage. Thank you for speaking out. Thank you for standing up. Stay strong. Thank you for your perseverance, and it's encouraging. So that's just kind of jumping through the chat. So definitely. Thank you so much, Cameron, and thank you for joining us, and thank you for being so willing just to come and share your story. So I'm pretty sure this is just one of many more platforms that will be coming your way. So thank you for getting us in early before you start charging people.
Not to put you on the spot, Cameron, but if you had any advice for someone who would be interested in getting a conversation started to create legislation, do you have any advice for where to start for that, or what you would recommend?
Just where to start. I would just say,
I just want to help them out a little bit.
Please.
Find just someone that you can trust and feel comfortable, whether it's your peer or your parent. I was the parent that Cameron trusts. And to, just for them to share what they're feeling. Because it is a dark side, but to know that we can make a change. And so for young people to know that this change can help so many people. So there's a slide about Nelson Mandela, how important education is as far as a weapon, but more importantly, when your action is put into a place, it can make a difference.
Can I ask, Mom, I want to applaud you. And how do you feel? What's come up out of this for you? As a parent and as a mother and working in Salisbury, I'm very familiar with how it is. Okay.
Yeah, and that's my colleague. I just want to say that as a mother, I'm so proud. Cameron walked the halls of the House and the Senate, and they want him to do things there. And our journey started last Saturday, where it was a forum for Dapper Dads in Prince George's County, and he was awarded an opportunity to speak to other young people. And so we're trying to even broaden this as far as education with the state and universities. And we would love to partner with the health department so this can be something that is broadcast, and using a peer like that, they will talk to their own. And so this is an opportunity for us as Marylanders to continue to grow. And as a mother, I'm a strong woman, and to see my son step up like that is nothing but the push and the drive in me to continue to escalate him.
Thank you so much. No, I just want to say thank you for having me again.
Okay, no problem. Definitely, and definitely kudos to our program supervisor, Karina Limerick. She was actually speaking about you last month about having a forum. She's joining us virtually today, but she definitely said you'd be great for this forum today. So awesome. But speaking of mental health, we'll be preparing for May, which is Mental Health Awareness Month. So I'll have Mindy to share a little bit about what we have going on.
Thank you, Raymond. Yes. Next slide. So May every year is Mental Health Awareness Month. We focus on things that we can do to support mental health and build awareness about the importance of mental health. So the Healthy Anne Arundel Coalition has a couple of things going on to encourage residents and businesses and organizations to participate. One thing is to light up green. So this is actually a national campaign to light up buildings and landmarks, your homes. Put up the green lights. If you do this, please send a photo to our Mental Health Awareness Month landing page. You can see the URL there on the top left, and there's also a QR code that you can scan. All the information that you will need will be on this this landing page. We also have a campaign where we are collecting photos. You can snap a selfie or a group photo show us what you are doing to support mental health. There are a number of categories that the SAMHSA, which is the Substance Abuse and Mental Health Services Agency. So they have a weekly focused topics, and there are lots of things that you can join in and show what you're doing to support mental health. And then there are a number of events happening throughout the county, and those events are also listed on the landing page. Additionally, this year we have a student video contest. This is for students in grades 6 through 12, and we are asking them to create a very short video to answer the question, what does the phrase "healthy minds, healthy lives" mean to you? This is our campaign headline this year. We're also using that hashtag "healthy minds, healthy lives" in our social media posts. And that contest ends on May 10th, and they can submit the videos again by going to that landing page. That's it.
Okay. Any questions, any comments? And just to go back just to some things that our health ambassadors are doing around the county. Our health ambassadors are doing mental health awareness sessions, or actually they're doing mental health first aid trainings that they've been trained to do. And I believe up to this point, they've done education for nearly 100 residents in our county with several more presentations left. So they've just been doing a great work around mental health in our county. So just to give kudos to our child partners, our community health educators, the work that they're doing in the county. And then we also have just great partners in this room that do work that's related to mental health. So hopefully we all can be able to tap in and just continue just to promote this across the county and promote this information. All information today will be inside of a follow-up email. So any conversations or thoughts you may have with Mindy that you may want to be able to tag on of ideas, it would be a great way to connect with her. We want to go to the next slide for me, Alex. And then this is just our call to action. We normally do the fourth Monday of the month, but next month, because that's Memorial Day weekend, we'll be doing it on the 20th. So May the 20th will be our next Health Equity Forum. Inside the chat, you'll have opportunity to share any thoughts through our Survey Monkey link. You can share about your thoughts of today, other types of topics we can be able to discuss. And then with our Raise Your Voices, if you're ever interested in sending videos or sharing thoughts or anything in our county, you can send it to our healthequity@aacounty.org, and all that information we shared inside the chat as well. Next slide. And then today's forum is also be on our AA Health Equity Facebook, and it'll be on our AA Health Salute page. So you'll be able to see it, you'll be able to share it. I will suggest that you just go onto that Health Equity page and share it on your page. I think Cameron's story, amongst other information shared today, is worthwhile being shared again. And then you can also visit us at aahealth.org. Purge, where if you have anything you want to see about our overall working of our health equity team. So I will just turn over to Donna for any closing thoughts.
Oh, I did not know I had closing thoughts. Can I punch that on over to Dr. Gadden?
A couple of things. I think one, please do, if you are having an event, and I know we get this a lot from our health ambassador partners, but please let us know. And please let us know as early as you can. It's a very busy season for us, and we want to make sure that we're prioritizing those who are participating with us, who are partners with us, who are in this work with us every day. We want to make sure that we can be there, and sometimes we get lots of events. And so we want to make sure that we have a 2-week window, but if you have more time than that, please do get it into us as soon as possible, because we're trying to spread folks at as many events as possible as we can in the spring and summer, as you all know, because you're at these events throwing them, it's very busy. But also for mental health awareness, if you're doing something, please let us know. We want to make sure we highlight that through our Healthy Anne Arundel Coalition. And please do continue to spread the word about our maternal health listening sessions. It is critical that we get that feedback and input and identify folks to continue on with us advisory role for that committee. And other than that, I think just thank you all for your time. Thank you all for coming out in person today. I know Annapolis traffic isn't always that friendly. You know, this time of day can be a bit of a challenge, but we are grateful to have you here with us today. And if there's anything else we can do for you, please let us know. But we are grateful that this forum that started out of necessity during the pandemic has continued and morphed into something else that we're really excited to have everyone. So thank you to the health equity team for their work in putting these together and having really important and engaging agendas.
Okay. Well, thank you, everyone, and we'll see you again on May the 20th. Have a great day.
No, I didn't.